The benefit to treating chiro students is that they know the correct position, like right off the bat. It's very, very nice. Take a breath in, Alex, and all the way out. All the way out. Good. Nice. All right, breath in, and all the way out. Perfect. Oh, don't want my hand to be like in the way of the camera there. It's kind of tricky with all the stuff on it. There we go. Cool. Perfect. Have you learned that one yet? No?
First time adjustment.
There you go. Hi, Alex.
Yeah. How's it going?
Good to see you. Alex is an old friend of mine and now a current second-year CMCC student. Again, that's the Chiro College in Canada here. And he's in today with a bit of a thumb injury, what appears to be a black eye, which admittedly I'm not going to be able to do much about.
Sorry.
That's okay. And just to kind of learn more about what it's like to be a practicing chiropractor. So, Alex, I'm going to let you kind of introduce yourself and talk about why you're here today. You go ahead.
Okay. Hey, I'm Alex. Like Adam mentioned, I'm a chiro student at the college here in Canada. I've known Adam for about 2 years now, almost. I would say.
Yeah, I think so.
2-ish years.
Yeah.
So I figured while I have a few more years left before I graduate, I'd spend time learning from people in the field, seeing what I can learn. And also, I had a surfing injury, hurt my thumb, so just coming here to get that checked out. And obviously, I've been flying, so a little bit stiff as well. Could always use some.
Sorry, you've been
flying,
flying
from on vacation.
Oh, okay. Well, see that wasn't obvious because he said flying, and I actually had no idea what he was talking about. So, where were you on vacation?
Portugal.
You went to Portugal.
Yeah.
Everybody I know is going to. I'm going to Portugal in like 2 weeks.
No way.
Everybody I know is going to Portugal. How was that? How long were you there for?
2.5 weeks.
So, wow,
yeah,
wild.
The flights are long, like 8 hours, and crammed in like sardines in the back.
When did you get back?
Last week.
Okay.
So,
yeah.
Still a little bit getting over some jet lag, and then
it takes that long, eh?
Well,
I don't know.
Yeah.
Like, okay. But you're feeling stiff, you said. So how's the neck, upper back, lower back, hips, everything?
I'd say just more lower back. That's more stiff. Neck and upper back seems to be okay because, like, I don't know, just always moving around. But lower back, sitting down and lying down a lot of my days.
Lower back's really the thing for it. Okay. Now you haven't been studying for much of the summer, I imagine, right? Because like that, we do get a summer, thankfully, and like that's our time to just kind of come back to life. So when you are studying at CMCC, like, do you get any kind of headaches, upper back discomforts, or no?
No headaches, no upper back. It's
good.
Usually, I think just the sitting is the biggest killer. Like, in lectures for, I don't know, what is it, 8 hours a day, sometimes even more. So
I'm acutely familiar. If you haven't seen my video on what the CMCC curriculum looks like, I'll go ahead and link it up there or up there. I'm not sure which corner it's going to pop in, but it's going to be one of those there. Anyway, okay, so thumb injury. Which thumb?
This one.
What happened?
That one. Finished the wave in the water. I'm walking back, and like the waves are pretty aggressive, and like the board is hard, and so when the current sweeps it back, like it hit my thumb there. Yeah, and like it's been in pain for like 2 weeks. Like I wake up and like it feels stiff and swollen, and like it's after a few seconds or minutes of moving it, the pain goes away. But like pressure and like opening wrappers or opening.
That's difficult for you.
Yeah, like the gripping. It's
okay. Now you went and saw your MD about the thumb.
Yeah.
How did that go?
He said he's like just a soft tissue injury, so he said like you can take anti-inflammatories, I guess, to manage the inflammation. But yeah, so just second opinion.
Have you found that those help you?
I haven't taken any anti-inflammatories yet. I just
fair enough.
like
That's stubborn.
I would rather just let it do see how it goes itself rather than jumping into medication. But
all right, well we'll take a look at the thumb today too then. Okay.
Cool.
So what we're going to do today is we're going to get into the physical exam. Going to take a look at you, and then we're probably getting into treatment. Any questions about that, or no?
Let's do it.
Perfect. Let's do it. And Alex, first things first, I'm going to get you to stand up and turn to your left about 90 degrees. Okay, just rotate for me.
Rotate. Sorry.
Oh no! You got the right idea. There you go. All right. Now I'm going to get you to take a small step towards the camera, please. Good. And now bend down, touch your toes for me. Okay. Any low back stiffness while you do this?
I wouldn't say like uncomfortable stiffness, but like doesn't feel loose.
All right, can you go any further than that, or you just
so I guess slow and steady, but
slowly. So Alex is able to get about maybe 6 or 7 inches above his feet, so he can't quite touch his toes there. I'll get you to come back up, Alex. I'll get you to extend backward for me, okay? Any discomfort in the low back with that?
Like more uncomfortable than
more uncomfortable. Forward. Okay, so is there on one side that it's more uncomfortable, or is it both sides? Just in the middle. Yeah. All right. So I'll get you to actually lay on your back for me next. Okay. First things first, Alex. I'm just gonna take one of your legs, relax it for me, relax it. And I'm just gonna lift that guy straight up as high as she'll go. Okay. So we can get to just south of 90. In fact, actually, I call that 90. Any low back discomfort with that? No. Okay. Good. We'll bring this back down. And we'll go over on this side, bring it straight up as high as it can go. Any discomfort with that? No? Perfect. All right. So, not that I had any doubt, but looks like your discs are fine. Okay, good. This is kind of interesting having a patient who's a chiro student, because I'm gonna quiz him after this to see if he knows what all the tests I'm doing are for. They're pretty standard, so I think he's gonna do well with that. Yeah. Alex, I'll get you to go. Oh no, wait, I gotta do the SI tests, right? Oh, I just gave away the answer. Shoot. All right, so hand behind the back, pushing through. Any discomfort with that? No. Get good. Any discomfort with that? No. Good. All right. That okay?
Yep.
Good. It's okay?
Yep.
It's okay?
Yep.
Must be nice. I can't do this with my hips. No, I gotta move the mic just a bit. Nah, they're way too tight, especially on the internal rotation. That's okay?
Yep.
Good. That's awesome. I'll get you to go face down now.
Down?
Yep. So Alex mentioned that he doesn't have much upper back stiffness, and he actually feels pretty good, which, all things considered, in this clinic is rare, but oh, there's a freebie. Now, with that low back stiffness, you're saying you kind of feel it on both sides, Larry?
Yeah.
Okay. Now, is it kind of up higher here, or is it down low, kind of at base of the sacrum?
More higher.
Higher up. Okay.
Yeah. Well, yeah.
Like this region here?
Yeah, around there.
All right. So Alex's primary tightness, he says, is kind of up in this region, which is just kind of below the thoracic spine at the top of the lumbar spine there, which coincidentally is also the origination site of the quadratus lumborum musculature, which is one of our primary core muscles for our back, actually, because remember, our core does go around our entire torso. So with him, he's also got a little bit of what I'm feeling as left SI restriction, which, I mean, everybody on this channel is familiar with SIs by now. But again, I think he's got primarily a muscular complaint, really localized to those quadratus lumborums up here, so we'll be able to take care of that with some of the sports massage that you guys have probably become familiar with as well. Could you keep up with all that?
Yep.
Perfect. That's the right answer. I was just mentioning that in a surfboarding incident, I assume that was in Portugal. Yeah. He ended up banging his thumb when he lost control of his board. So, Alex, I'll just get you to point with your other hand here. Where exactly are you feeling the most tender along your thumb?
Mostly like along
So you're down kind of on the inside aspect, down into almost the carpal bones.
Yeah.
There. Okay, so the carpal bones is the fancy anatomical term for the hand bones. But so we're not up here. How's when I squeeze that?
That's okay.
That's okay.
If you don't,
by all means, go ahead.
Like along this joint, is like if you squeeze a certain part on this area, that's where it hurts. Like just along this like ball.
Okay. Like so you're deeper down, kind of where the metacarpal joint, which is the intermission between the phalange bones, which are our finger bones, meets again the hand bones. Right, this region right here.
Yeah, actually. Where your thumb is.
All right. My mistake, actually. That is the metacarpal phalange joint that he seems to have banged up. And for you guys there, I'll put a picture up so you guys know exactly what I'm referring to. Now, with that, is it kind of on the inside of the thumb or the outside of the thumb that we're trying to discover? The outside of the thumb, which coincidentally is obviously where the surfboard hit. Right? It'd be pretty hard for it to come at it from this angle here.
Yeah.
Okay, so now I want you to keep your thumb very, very still. Okay, actually flex it as hard as you can, okay? Now, don't let me move it. Is that painful in itself? Okay, relax. I'm going to try to move your thumb. Don't let me move it, okay? Just keep it where it is. Painful?
No.
Okay, keep it there. Don't let me move it. Fight. That's okay?
Yeah.
Okay, good. Fight.
That's sore.
That's a little bit sore, right? Okay, fight. That's okay?
Yeah.
All right, so how's right along there too?
It's okay in there. I think a little bit more on the side.
Okay.
Is where that's a little bit sore. Not like crazy, but a little bit sore.
Not crazy, but a little bit sore. Okay. So primarily in that thumb flexion, or what's this one called? I believe this is you remind me, right? Because the opposition, that's what it's called. Opposition direction is what is most provoking for his thumb complaint there. And if that is where the surfboard hits, tapping it like so, is that painful?
Yeah, it's
a little bit. Okay. One other thing we can do to rule out any hairline fractures is to actually rely on a tuning fork. So we start that thing vibrating, just like so. Is that painful or no?
No.
No? Okay, once again. Painful or no? No, okay. So very unlikely that he ended up fracturing the finger, which means that the MD is probably correct in this case that it is just a soft tissue injury. So the things we're going to do with that, if you don't want to use the anti-inflammatory drugs, you can always just ice the hell out of it and try to move it as much as possible, okay? I'll treat for it today, too, with some of the Graston tools that I have, and we can also adjust through there, too, okay?
Thank you.
Of course. Okay, so you can scooch the hip towards me. Thank you. Good. Awesome. Nice. Okay. So the benefit to treating chiro students is that they know the correct position, like right off the bat. It's very, very nice. All right. I'll get you to take a breath in, Alex, and all the way out. All the way out. Good. Nice. Well done. I'll get you to go on your other side, please.
Okay.
I say right after I kick the wall. All right. Just like so. Thank you. Leg here. Hips a little closer. Good. All right, breath in and all the way out. Perfect. Good stuff, buddy. So as I forgot to say, usually when I'm doing instrument-assisted soft tissue therapy on people, I ask them a question. Do you have a favorite CMCC memory from first year or not really? Was it just too much stress, too much school? Totally understand if that's the answer, not to put you on the spot.
That's actually a good question. I think my favorite memory, we had this boat cruise in orientation week.
Yeah.
Where like you just get to meet your classmates, and it's interesting because you're kind of like on the water, so you can't leave, so you're kind of not forced, but like it's a good opportunity to meet new people, when you're shy or like not knowing anyone there. So
Alex, are you shy?
I wouldn't say I'm shy.
I was gonna say you're not shy.
I'm just quiet until I'm comfortable.
Fair enough.
So I was lucky. I met some good friends in my pod, my little group in Welcome Week a few days before. So we kind of hung out, and then we made some more friends on the boat as well. So I'd say that was probably my favorite memory so far.
That's good, man.
Until I could think of a better one.
Yeah, hey man, orientation week. For anybody watching who's considering going to CMCC, the orientation week, the social package there is better than most undergraduate orientation weeks by a long shot. Okay, Alex agrees. Most anybody I've talked to agrees. I am biased. I did organize the week one time when I was still in the school, but like, holy, the memories are there. Okay, so highly recommend. But I'm glad to hear that you got a big kick out of that as well, Alex.
Yeah, it was good.
I'm happy that you guys got it because it was canceled for a while with COVID.
Yeah, we were the first one back, I believe.
Yeah.
So.
All right. I'm just gonna put that right there. We'll just put that on the floor. That's fine. You just let me know if this is too painful, okay?
Okay. What was your favorite CMCC memory?
My favorite CMCC memory? Well, I have to put the obligatory meeting my girlfriend there, or else she'd be mad when she watches this back later. But other than that, it's got to be, like, the big thing about CMCC was I was able to treat it as an opportunity to really reinvent myself. I was like you. I was quiet until I'm comfortable, and I still believe I'm an introvert. But when I went to CMCC, on like the night before it all started, first year, I remember telling myself, I'm going to make this place my home. And I very much did. Ask anybody I went to school with, they'll tell you Adam, he would never shut up. He was a part of like every committee, everything he did, he had a hand in it, he was involved everywhere. And it's because of that, like, I really did gain a lot of confidence, enough so to open up my own practice within the first like 2 years of being out, right? So that's it's hard to just isolate one because there were so many, from the friends to the parties to the long hours of studying, which I actually look at fondly now, believe it or not. Yeah. So lot to dissect there. So my answer is the day I met my girlfriend, obviously. Clearly.
Good answer.
Exactly. Here, you just hold out for 1 second. All right. So get you to just turn the hand over good. Alright. Oh, don't want my hand to be like in the way of the camera there, or my elbow too, rather. We're gonna adjust through the thumb now, okay?
Sure.
It's kind of tricky with all the stuff on it, but that's okay. There we go.
Cool.
Perfect. Have you learned that one yet? No?
First thumb adjustment.
There you go.
Awesome.
I think that's a second or third year thing.
Yeah, that was awesome.
Good. Now, as we know, Alex has a lot of the tightness up kind of in the origination of the QLs, as I linked earlier. So we're really going to be focusing primarily on his low back, just above and below that region. So now, Alex has never had this done before either, so if you start to feel like this is going a little bit too intense for you, you just let me know and I'll back off, okay?
Okay.
Yeah. That being said, the camera is on, so people will know that you're soft if you complain about it. Just want full transparency there.
So far, so good.
Good. find all of that?
Honestly, really cool.
Good.
Grafton was awesome. It was my first time getting Grafton. Thumb adjustment was really cool. Feels good. Also, the back Grafton, that was good. I feel like a lot more relaxed. So I'm very happy.
So, like, you came in here not really being familiar with what the instrument-assisted soft tissue therapy really was, right? Because you haven't had experience with that before.
Yeah.
Now, one thing that's important to note is that a lot of chiros will adjust, obviously, yes, because that's kind of like our thing, but not many of them will diversify their techniques. They won't take the extra courses, like we mentioned beforehand, that the tools require, or the acupuncture that I also do, that we would explore further for you if the low back still doesn't want to let up, okay? And that's a little unfortunate, because that's what we find, or that's what I find patients to respond best to, something called diversified care. So Happy liked it a lot. Okay, and I think that for you, like as a chiro student, any chiro students who are watching potentially, really try to diversify your skill set, get good at a lot of things, that way you're able to address one complaint from multiple different avenues, because every body's going to respond differently. Do you have any questions about kind of what we went through here today, Alex, or was it kind of, hopefully it was what you were looking for?
Yeah, no, that was great. Honestly, I'm very happy, so.
Happy to hear that.
2 thumbs up.
Well, nice, because you're just thumb. Okay, we can end on a high five.
Yeah.
Well, very good. We'll take care of that. That works.
Don't forget to like and subscribe.
Thank you so much, Alex.